Hi, I'm Teresa San. It's my pleasure to join the virtual Osteology Symposium. Today in my case presentation, I'm going to focus on periodontal regeneration to think outside the box. Let me introduce you my patient, 30-year-old Miss Song. She was worried that she will lose many of her teeth in short time due to the tooth mobility. Look closely inside her mouth, we notice the accumulation of calculus, generalized recession and erythema, suppuration around tooth number 3 indicated the signs of active infection. Aesthetic is also her main concern due to the exposed metal color and her high smile line. Upon initial examination, we can see generalized deep pockets with bleeding on probing and generalized mobility. Horizontal bone loss across the entire dentition around 40 to 60%. Furcation invasion on all molars and localized extensive angular bony destruction were also noticed. Considering the severity and rapid progression, the diagnosis is periodontitis stage 3, grade C. Many teeth are questionable to hopeless prognosis, but we shall keep in mind that prognosis is dynamic and can be changed after treatment. After controlled inflammation and infection, we can further focus on specific area by surgical approach. Our surgical treatment plan include regeneration, resective, and soft tissue surgery. Furcation and angular defect around tooth number 14 and 15 were treated with regeneration approach. Osteoplasty were performed on shallow crater defect and grade 1 furcation over mandibular left sections for pocket reduction. Minimal invasive approach for regeneration were performed around mesial of tooth number 5. After proper endodontic treatment, tooth number 30 and 31 furcation and circumferential defect were treated with regeneration. Let's look closely on tooth number 2 and 3. Tooth number 3 has vertical defect toward mesial and distal root apex that you can see on the CBCT. However, the integrity of palatal root provides us great stability, also favor our accessibility from the buccal area. Therefore, we are confident to move towards the regeneration approach. After buccal flap elevation, we can see calculus accumulated toward to the apex. Thorough debridement of the root surfaces, a combination of endogam DFDBA and collagen membrane was used for the GTR. At 10-month follow-up, we can see radiographic bone field around the root, but if we look closely, root resorption was noticed associated with the mesial root. At re-entry, we can see the resorbed root and regenerated newly formed granulation tissue. After removal of the mesial root, a tuberosity CTG was utilized to augment the carinized gingiva to provide tissue stability over time. At 1 year, when compared pre-op and post-op CBCT, the radiographic bone field indicate the prognosis of the tooth was significantly improved after the treatment. Around tooth number 9, thin biotype and recession was still present after provisualization. Therefore, soft tissue augmentation was performed by a tunneling technique and the epithelialized CTG. Patient maintained excellent plaque control throughout the treatment, and we can see radiographic bone field over angular defect and furcation defect, reduction of the probing depth, bleeding on probing, and mobility after phase 2 therapy. After final touch on the aesthetic area and also prosthetic refinement around tooth number 3, we deliver the final prosthesis 10 months after the surgical treatment. You can see the improvement of the aesthetic. We were able to maintain the integrity of her dentition, and Ms. Song is also very satisfied with the outcome. Her effort is a key element for the success of the treatment. A 3 to 6 months interval periodontal supportive treatment was then proposed to her. Follow-up to 3 years showed the stability of the treatment. At 3 years, we can see radiographic bone field and increased density of the lamella dura. Same for the mandible, the regeneration result was stable at 3-year follow-up. In conclusion, in our case, we can see with proper diagnosis and treatment, the risk of tooth loss can be dramatically changed after treatment. Therefore, we should always think carefully and thoroughly sometimes outside the box, and try to save the precious dentition. Thank you for your attention, and I hope you enjoyed this case presentation. Please stay safe. Together, we will get through this challenging time soon.